हर एक को कहते हैं ना अपना बच्चा तो बहुत अच्छा लगता है वो, बट मेरा बच्चा वाकई हमें बहुत प्राउड फील करा के गया।
Actor Suhani Bhatnagar, known for her role as Babita Phogat in Dangal, passed away in Delhi at the age of 19 due to complication from a rare inflammatory disease. She was admitted to the hospital on February 7th and passed away on February 16th. Symptoms appeared 2 months prior with a confirmed diagnosis just 10 days before her death. The sudden death of the teen actor sparked a discussion over the disease dermatomyositis. But what is dermatomyositis? What are its causes, symptoms and treatments? Let's understand in detail. But before that, like, share and subscribe to Moneycontrol.
सुहानी को हाथ 2 महीने पहले हाथ में लेफ्ट हैंड में स्वेलिंग शुरू हो गई थी। तो काफ़ी डॉक्टर्स वगैरह को दिखाया हमने यहाँ पे, डर्मेटोलॉजिस्ट को दिखाया, हॉस्पिटल्स में दिखाया, एक्सरे वगैरह, अल्ट्रासाउंड, एमआरआई करवाई, क्या प्रॉब्लम है, कुछ किसी को डायग्नोज नहीं हो पा रहा था। फिर एम्स में लेकर गए उसको, एम्स में डायग्नोज किया उन्होंने डर्मेटोमायोसाइटिस।
Dermatomyositis is a rare autoimmune disorder causing inflammation in the skin and muscles. Symptoms include skin rashes, swelling, and muscle weakness. Women are disproportionately affected by the disease, being twice as likely as men to contract it. Those displaying symptoms may also have a connective tissue disorders like lupus or rheumatoid arthritis. The disease predominantly targets individuals aged between 50 and 70. The exact cause of the dermatomyositis remain elusive, but it shares similarities with autoimmune disorders where the immune system erroneously targets the body's tissues. Genetic and environmental factors also might play a role. Some other possible causes include abnormal genes, cancer, particularly in older individuals, smoking, certain medications, autoimmune diseases where the body's immune system attacks its own tissues, environmental factors such as infections or exposure that may trigger the disease. The symptoms arise from inflammation and swelling in the blood vessels that supply the skin and muscles, and they include red rash on the sun-exposed area, often accompanied by itching or pain, red or purple swelling of the upper eyelids, red or purple spots on the knuckles, elbows, knees and toes, stiff and painful joints, especially in cold condition, scaly, rough and dry skin potentially leading to hair thinning, swollen, red areas around the fingernails, hard lumps under the skin caused by calcium deposits, muscle weakness in the neck, hips, backs and shoulders, difficulty swallowing and change in voice, fatigue, fever and unexplained weight loss, muscle ache. If you experienced muscle weakness or notice an unexplained rash, it's important to seek medical attention promptly. Difficulty in swallowing. Muscle in the esophagus affected by dermatomyositis can lead to swallowing difficulties, potentially resulting in weight loss. Aspiration pneumonia. Difficulty swallowing increases the risk of food or liquid entering the lungs, causing aspiration pneumonia. Breathing problem. Dermatomyositis affecting chest muscles can lead to shortness of breath. Calcium deposits. As the disease progresses, calcium deposits may develop in muscles, skins and connective tissues, especially in children. If your doctor suspects dermatomyositis, they may advise undergoing the following tests, which is blood analysis. This test checks for elevated muscle enzymes and autoantibodies guiding treatment decisions. Chest X-ray. This assesses lung damage which can occur with dermatomyositis. Electromyography or EMG measures electrical activity in muscles using a needle electrode, identifying affected muscles. Magnetic resonance imaging or MRI creates detailed muscle images, assessing inflammation over a wide muscle area. Skin or muscle biopsy confirms diagnosis through tissue analysis. There is no cure for dermatomyositis, but symptoms can be managed with treatment evolving based on individual factors such as symptoms, age and overall health. Along with the treatment that doctors suggest, one should also adapt as per the severity of the symptoms, take therapies like physical therapy, speech therapy or dietetic assessment. Physical therapy and exercises like stretching are recommended to strengthen muscles, while orthotics or assistive devices can aid mobility. With dermatomyositis, areas affected by your rash are more sensitive to sun, so wear protective clothing or high protection sunscreen when you go outside. Take anti-inflammatory medications as per prescription. You may be suggested surgery to remove painful calcium deposit and prevent recurrent skin infection. And most importantly, listen to your body. Rest when you need. Acknowledge your emotions. Share this video with someone you care. Knowing a disease is most important before you deal with it. And for more such informative content, keep watching Money Control.